Let's start. So first, I want to start off by welcoming all of the organizations that are represented here today, all of whom are leading the fight against colorectal cancer here in Atlanta, in Georgia, and throughout the country. We've got individuals from the Atlanta Medical Association, the Gastroenterologic and Endoscopy Society, Emory, and this Roundtable on Cancer, and of course, a lot of interest from folks at Wellstar, Piedmont, Emory, and the Cancer Treatment Centers of America. March is Colorectal Cancer Awareness Month. And in Georgia, colorectal cancer is the third most commonly diagnosed cancer among men and women, and it is also the second leading cause of cancer death in both men and women in the state of Georgia. However, thanks to advances in screening and treatment technology, the death rate has been going down since the 1950s. As we all know, those advances in technology are not shared equally, though, among all the men and women of our state. People who have access to affordable preventative care, who can catch cancer early, have a much higher chance of survival than those who catch it later. And the later a cancer is caught, the more expensive treatment becomes, which means the people with the least get hit the hardest. The other thing is the age now for screening for colon cancer has gone down. It used to be 50. It's really important for people to know that that number is now 45. And we need to do more work, I think, here in the General Assembly, working with our doctors and seeing how we might actually be able to write into law screening access for folks who are younger than that. I'll share a personal story with you because colon cancer was never really something that I thought about until a friend of mine at 38 was diagnosed. He was a successful dentist, was enlarging his practice, and so was very stressed out and started to lose weight and thought nothing of it because when you're busy trying to open up another office, you're stressed and you'll lose weight. And he started having pain one night. His wife insisted that they go to the emergency room. They started to do some tests, and he was diagnosed with stage 4 colon cancer. He started to do treatments and lived another 15 months and passed away just days after his 39th birthday. It is something that can hit any of us, whether you've got family history or not, and it's incredibly important that we take this particular cancer seriously and access the screening that's available for us. So as we recognize March as Colorectal Cancer Awareness Month, it's very important that we take aim at the disparities and ensure that all the people in the state both know their options and can take advantage of them. Advancing patient care and clinical education while also ensuring that communities make healthy lifestyle choices are ways that we can lower the risk of developing colorectal cancer. And if there's one thing that we can all do to mark this month, it's to encourage everyone we know to consult their healthcare provider and begin screening regularly. And if there's one thing that those of us here at the Capitol can do, on the other hand, it's to expand Medicaid and offer other high-quality care to low-income Georgians. Fighting this disease should not condemn a family to bankruptcy. I am going to leave the podium now and introduce and invite Dr. Kevin Woods.
Thank you, Senator. I want to thank again all of our elected officials that are behind us today in support of March as National Colorectal Cancer Awareness Month. Again, I'm Kevin Woods. I am the president of the Atlanta Medical Association, who served Atlanta and also Georgian community for almost 132 years. On behalf of physicians and also other caretakers that are in the lives as caregivers and also as providers for patients that are affected by colorectal cancer, we want to say thank you for this attention today on this wonderful issue. Just want to say a few things that have already been stated, but 45 is the new screening age. That's if you're average risk and you have no symptoms. For those patients that have family members that have been affected by colorectal polyps or cancer, we ask you to talk to your doctors because you may need to be screened more sooner than 45. In Georgia, we have many counties that are doing a great job in screening their populations, but in many other counties in Georgia, unfortunately, up to 68 per 100,000 patients are being diagnosed with this unfortunate disease. One thing that we want to tell patients and also tell our fellow Georgians that this is a beatable cancer, so early detection is the key. I would like to share the podium with my colleague, Dr. Saurabh Shala of Emory University, and also he is the president of Georgia Gastroenterologic and Endoscopic Society, and he just wants to bring some words on behalf of all the gastroenterologists of Georgia. Thank you for your time.
Thank you, Dr. Woods. Thank you, officials, representatives, and the senator. March is the colon cancer month, and we really applaud the officers here for taking the time to acknowledge this important effort that we are trying to reach out to. One thing that I would like to emphasize, as Dr. Woods said, colon cancer is really common, but it is one of the few cancers that we can catch really early and even prevent. And that can happen with screening. And as the senator said, colon cancer now we've noticed is happening at a much younger age, so the screening age has been dropped to 45. The other thing is that it's not just one test for everyone. There are several different options for screening, and so whatever works for people is the one that we recommend. Again, I would like to thank everyone for their time, for spreading this important message. Thank you.
And lastly, for our colleagues that could not join us, but there are many medical professionals in private practice and also our large healthcare organizations such as Emory University, Augusta University, and Augusta Health, Navicent and Macon, Grady Health System, Cancer Treatment Centers of America as a part of City of Hope Hospital, Piedmont Healthcare, and also Morehouse Healthcare. We encourage you as patients, as friends, as colleagues, and also as neighbors to get screened and get screened frequently. Thank you so much, and I'll turn the microphone back to Senator Halpern.
Good morning, everyone. And I just want to thank my senator, Senator Sonia Halpern, and all those that are gathered here this morning for shining a light on this issue. Many of you may or may not know that I am a colon cancer survivor. In 2018, I was tested and told that I had a mass. And I want to shout out Cancer Treatment Center of America. They went to work. They prepared my body for surgery. They were with me from the beginning to the end. They saved my life. When these doctors and everyone say early detection is important, it is vitally important. The way it was found was because down here we get, a lot of germs and everything, and so I decided before I go back in session that January on 2019, I'm going to all my doctors. And I went to my gastroenterologist, and he said to me that year, he said, well, you can't have it this year because it's not 5 years yet. So you have to wait a year. Well, in waiting a year, the mass was growing in my body. But thank God he scheduled it the next year and they found it. And thank God I did not have to have chemo and I did not have to have radiation. They went in and got everything out, and I thank God for that. But again, I say early detection, know your body, and even if you think something's going on, ask your doctor. Ask your doctor to give you those tests to find out. So again, I so appreciate it, and it is so vitally important. Thank you.
Well, I will say that we have prepared a resolution also recognizing March 2022 as Colorectal Cancer Awareness Month, which I will be presenting. And again, it is a preventable disease. Screening is available to everybody who has insurance at no charge. And we encourage everybody to get screened, see your doctors, and just know that colorectal cancer is something that is preventable when treated early. You'll notice too, it's St. Patrick's Day, so a lot of folks are in green. I am wearing blue, and so for colorectal cancer awareness, wear blue. Thank you so much.